So a judge has given the family of a young California girl declared brain dead an extension to find her a long-term care facility. Jahi McMath has been on life support since December 9th. She had complications following a tonsillectomy. A court order required the hospital keep her on a ventilator. Even though doctors say she is clinically dead, her family says they have proof she can move, but the hospital says they are delaying the inevitable. And joining us now to discuss the medical condition involving this case is Dr. Devi Parampil, a physician and associate professor with NYU Medical School. How'd I do with your name? Was that okay?
That was good. That was good.
Good to have you here.
Thank you. Thanks for having me.
Tonsillectomy. So that sounds like a pretty straightforward procedure, but can it be tricky?
Well, it usually is pretty straightforward. In this case, I mean, there's a situation where she already had chronic sleep apnea, so that's why they were doing the tonsillectomy. So she might have already had problems affecting her heart and lungs before they even did the surgery. So that
could be the complicating factor.
Yeah, exactly. And then there's always complications of any surgery that you're at risk for, like blood clots or infections. So there might have been a few other factors that we're not aware of.
Okay, I had to write some of these down because some of these issues are pretty complicated, and I want to at least ask the question correctly here. Clear up this what appears to be some conflict over the definition of brain dead. And the reason I'm asking is California is a state, like most states, that defines brain dead as no brain wave activity, right?
Exactly.
But there seems to be some conflict over what precise physical structure, am I saying this correctly, constitutes the brain, with broader definitions available, including the brain stem.
Exactly.
So I really want to understand what this family is going through, and to do that I feel like we need to get a bit technical here. Don't take us too deep into the weeds, but help us with that distinction here.
Okay, so there's a whole spectrum of brain activity. So when they talk about brain death, they're talking about everything. The brain stem's kind of what controls your reflexes in your face and in your body, your breathing.
Should it be considered in the whole discussion?
Yeah, it definitely has to be. So that's even when you go to the doctor, when they shine that flashlight in your eye, they're looking to see if your eye responds to light, if your body responds to different things. In this case, the doctors are arguing that this poor girl is not having any response to her environment. So she's not aware of herself and she's not aware of her environment. Now, what the mom or the family is saying is that she's responding to their voices, so that's very different. If someone is responding to a voice or able to follow you, even if they can't talk or if they can't really move, that means they have some awareness, they have some consciousness. So that person would not be dead if they really are conscious. But there's controversy about whether she really is responding to them.
So there have been, at last count, I think it's 5 or 6 doctors that have taken a look at this case, and all have concluded that she's brain dead. So what are they seeing that the family is having a difficult time accepting?
Well, I think part of it is also that in this situation, they have a 13-year-old child. This is not an elderly person with a terminal condition. So anybody would have trouble accepting that somebody's dead, that their child is dead. And usually we have stages of grief like denial and anger. So they're probably looking at their daughter, seeing what they want to see. And then when the doctors come in, it's already a contentious situation. They didn't expect their child to die. They don't know if something went wrong. And they're being told about EEGs and brain activity. There's a controversy there. They're being distracted from their grief and focused on their fight against their hospital.
So you do this kind of work, and you certainly study in this area. So when you've got 6 doctors that are coming to the same conclusion, maybe on a percentage basis, what are the chances that they're all wrong? All wrong?
Well, that's very rare. I don't think that 6 different people would be wrong, but I do think that in terms of the urgency of taking her off life support, I don't know why it has to be done immediately. So I work with hospice and palliative care physicians, and usually what we try to do is even if the child is dead or the person has died and we think that they're brain dead and they're not going to recover, we try to work with the family, because the family is going to continue after that time, right? The family has to deal with the fact that they've lost their loved one. So in this situation, kind of forcing the family to accept something that they don't want to accept yet, and forcing them to go to court, it's very tough on them as well.
You mentioned sleep apnea being a factor here. Could it be that there is something else in the case that the doctors are aware of, that the public is not aware of, that is leading them to push in the way they appear to be pushing at this point?
Yeah, of course. So that's the most difficult thing. So in any case, if a patient or a family member talks about their health or their situation, whether it's related to a lawsuit or a complication or anything, they have that freedom. But the healthcare team in the hospital is not allowed to talk about it, even if they're trying to defend themselves. They can only talk about it in court or in situations like that, but they're not allowed to talk to the media.
You know, and maybe this is something for the entire country and the world to sort of consider here. Technology, right, is improving at such a pace, and the ability of physicians like you to keep people alive is improving at such a pace. There needs to be a discussion, maybe it's being had in some quarters that we're not totally aware of, on what it means, what life and what death really means. You get what I'm driving at?
Yeah, it's actually already being debated in some of the medical journals, like the New England Journal of Medicine. So 100 years ago, you know, the definition of death was very clear. If your heart stopped beating, you were dead. That was it. But now with technology, if your heart stops beating, someone can do CPR. You know, if you're in a shopping mall or an airport, someone can get a defibrillator. You'll be okay. You'll get life support. But now that's what brought in this whole discussion about brain death, because we never really saw that in the past, where the brain was dead but the rest of the body was alive. And we're thinking about it more because of organ donation. That's where it comes up the most, because you want to have a situation for organ donation where the brain is dead but the organs are still alive. It really, that's a very gray zone. So, you know, it's challenging our old notions.
Doctor, that was terrific. Thank you.
Oh, thank you.
Dr. Devi Parampil.
Perfect.
Is a physician and associate professor with NYU Medical Center. It's good to have you here.
Thank you.
Happy New Year.
Happy New Year.
Yeah, thank you.